Hi, everyone. It's John Hammontree. We are here with our first ever Reckon interview live. My guest this week is Michael Harriot of The Root. He was our guest on a podcast on Monday. If you haven't listened to that, go check it out. But today we are talking about how the world has been turned upside down by the coronavirus. Michael, as we're waiting for people to join, why don't you tell me a little bit about how your life has changed in the last few weeks?
So it's weird because so my life really hasn't really changed
You work from home.
that much. I wrote from home and I'm still writing from home. I guess I make less trips from the grocery store. I am the designated grocery getter. And so I make fewer trips to the grocery store. But aside, and I travel less, of course, now you have to figure out ways to write a story or to research a story now that you basically can't leave the house. So there's a lot less travel, and I spend a lot less gas money. But
Yeah, me
other
too.
than that, man, it really hadn't changed much for me. It's just weird to like not leave the house that often. And I spend a lot more money with Amazon or
Yeah, me
whoever I'm
too.
shopping
Jeff Bezos
stuff.
is making out
Shop.
like a bandit.
Yeah,
Um,
yeah, he's doing good.
One of the things that we've seen in Black Americans at a disproportionate rate to white Americans and to other minorities. Um, in Alabama, the state is 27% Black. At the last numbers I saw, 45% of the people who have died of coronavirus or died after being diagnosed with coronavirus in Alabama are Black, and 38% of the cases that have been confirmed are of Black Alabamians. You've written a little bit about why you think that is and what some of the data shows. Can you talk us through about what you think is happening right now?
So, first of all, we live in Alabama, which is has an inordinate rate of poverty in Alabama. We are higher. The Black poverty rate is higher than the white poverty rate, so that attributes it to some. Right, hit the sound button on my phone, but so Alabama is one of the states that refused the Medicare expansion. So fewer people in general in Alabama have health care, and the Black lack of insurance is higher than the white lack of a rate of insurance. That attributes it. And then, Alabama, of course, lands on that list of states with the highest rates of obese population, lands squarely in that. And then when you combine that with the two highest rates of infection are into, as with most states, are in the two biggest cities in the state. Well, the two biggest cities in Alabama are, disproportionately Black. Birmingham, which I think the last I looked had the second highest number of infections, is the third blackest city in America.
Right.
And Mobile which has the highest rate, the highest number of infections, is the second blackest city. And on top of that, the disproportionate rates of unemployment. We know employment is tied in America to insurance. And so when the Black unemployment rate in Alabama is twice as much as the white unemployment rate, and that means those people, because they can't get the Obamacare, Medicare expansion, how do they get insurance, right? How do they pay for themselves to get tested? How do they come out of pocket when all of the businesses are closed down? More.
Well, and the ADPH came out with Governor Ivey's press conference the other day, and they acknowledged that this disparity is there, and they attribute it to some of these underlying health factors that you were just kind of outlining, higher rates of obesity and diabetes and things like that. And yes, that is true. But even those underlying problems, in your history of research and writing and recording, those underlying problems didn't just happen by accident. They're not just natural. Like they're the accumulation of decades of policy
contribute to the disordinate death rate, and we don't explain how we got to those underlying factors, right? So when you talk about, let's talk about, for instance, obesity, right? So obesity is tied to food consumption. And if you go in downtown Birmingham, like there literally are no grocery stores down there. You can't, like there are Publix like littered throughout the city and the suburbs of Birmingham. But if you are immediately downtown in the blackest areas, in the poorest areas of Birmingham, there are no grocery stores, not, and that is an exacerbating factor, because if you give a child a piece of steak, right, that steak might, offer some nutrients if you give them some steak and vegetables, right? But if they don't have access to some vegetables, some fruit, some meat, some bread, the best thing that they can do is to get the calories, get as much calories as they need it when they can. What do you do when you want some, more calories? You load up on carbs, load up on sugars, you load up on, it lasts a lot longer and your body takes a lot longer to process it. Well, that's what gives you, that's what produces obesity. That's what produces, when you eat sugars, when you eat processed carbohydrates, what you get is an insulin rush, and your pancreas has to work harder to fight it, which means you're exacerbating diabetes, another factor in high COVID death rates. It increases in obesity, increases high blood pressure. It increases the places in America where a lot of these regulations, being in a red state, the regulations on industries are a lot more lax, right? So it's one of the few places, like downtown Birmingham is one of the few places I've ever been where there are factories like centrally located downtown, which means you don't get as much clean air. Right? Mm-hmm. Like there's been this ongoing fight with the factor to COVID-19, right? So we talk about these underlying factors without, acknowledging the policies and the history and the disparities that contribute to these policies. It's not like Black people just eat more, right, or Black people just don't exercise. It's more than that, and we should acknowledge that.
Well, and the factories you're talking about, we talked about the history of redlining a little bit on the podcast, I think, but
right.
Those factories were zoned for Black neighborhoods and not for white neighborhoods. And so, over time, that adds a spreader events. There was a funeral in Albany, Georgia, that I think they've attributed a lot of the spreading in southwestern Georgia to. And you were talking about one that I think you're researching right now or have just written about in West Virginia. Events that we know took place, but people still couldn't get tested, even if they had been confirmed to be in contact with somebody who had coronavirus. Do you think that that's something that's more likely to affect lower end basketball players can get tests whenever they want, but not necessarily people in rural West Virginia or Georgia?
Right. So there are a bunch of to do that, right? Again, we talk about being insured being tied to employment. Well, that affects the way someone can get tested. If you don't have insurance and you have to come out of your pocket, you have to pay, despite what like you'd hear, the president say, people are being charged for those tests. And so you first of all, you have to consider the financial considerations of it. And then you have to consider the accessibility. When I wrote about Georgia a couple of weeks ago, and there are 9 counties in Carolina, and it just happens to be in some of the blackest counties in the state. And so it's hard to, it's hard to get tested as a preventative measure when you have a finite amount of money to pay out of pocket if you don't have insurance. And then it's hard to, to risk that money speculatively when you don't know if you're going to get it back, when you're going to be working. and how you're going to even get to a place to be tested. You could get to a place to be tested, and you might not be able to get tested. We saw a case in what Gadsden in Alabama a couple of weeks ago that I wrote about, where a family, 9 people in the family, a Black family, called if they still have the disease. And some of them went, and the places refused them because they had a finite amount of tests, and some people just don't have access to testing. This place in West Virginia that I'm writing about and researching, they don't have a hospital in the entire county. The nearest hospital is 45 minutes away. And when you live in a rural community and everybody is sick, how are you going to get to the hospital?
Right. About disparities in deaths and coronavirus cases without context, which you and I discussed a little bit about in one press conference, while in another press conference, they dismissed the need for expanding Medicaid. He'd like your thoughts on that.
Well, I think that hypocrisy comes from, I think, first of all, I think it's going to change, right? Like this crisis has shown us the need for that we need universal health care, and it should be a human right? Like in the richest country in the world, you shouldn't, so that this country has enough money, right? We just handed out trillions in what we call stimulus, but most of it went to corporations and business and wealthy people. Out of the Lakers got a stimulus loan, and there are these large corporations who are getting them, and we're still denying health care to the poorest people in the country. And we're going to see the effect of that, if not who don't have health care. And so, Mr. Archibald is right in that they're standing there and talking about these healthcare disparities as if they don't know why these healthcare disparities exist, but they are going to have to confront these healthcare disparities because they can't extricate the disproportionate rates of infection and deaths from they withhold healthcare from people. It's not like they're not offering it, right? Like Alabama is actively, so we don't want the federal government to help you get healthcare, which is an insane idea, right? And so someone is going to have to atone for that. And it's up to people like the people who are watching this to force their government to acknowledge and atone for that and to offer healthcare as a human right.
Well, and I think you wrote about this a few weeks ago. So many of the workers that we have designated essential during this crisis, grocery store workers, ship shoppers, people who work about they're caught in that Medicaid expansion gap. And so, we're sending people to the front lines of this virus without a safety net.
Yeah, and I think we sometimes forget that the people who are showing up at our doors with food and the utilities that we need to live, they don't have health insurance, right? They're not protected. They're not employees, really, right? Like shift workers and Uber drivers and the Grubhub people, which means that they don't get any kind of benefit except for the low wages they earn. And the other thing is, a lot of them work part-time. Right. So if you work 39 hours a week, your company doesn't have to offer you health care. Right. Like if you work one more hour, though, you're considered an employee, which is another insane idea that they are reaping the benefits of your labor without offering you the same thing that they would offer someone who worked one more hour. Right. What they're saying is like, what we're saying is we're protecting, because what it essentially is protecting the business interests of these large corporations more than they protect the people who work and produce the revenue that these corporations benefit from.
In just about 3 hours, the governor's stay-at-home order will expire and a new safer-at-home order will take place. We'll start seeing the beaches opening, some retail, not any barbershops or beauty parlors or anything like that yet. To our plan as it compares to some of our neighboring states, but also as it compares to the rest of the country? Do you think that we are moving prudently?
Well, so I can understand, right, the concerns of business owners, of small business owners, of people who just want to get out of the house, of people who don't know if who don't know if they're going to have a job if the economy continues to collapse, right? So I understand those concerns, and but I really feel like those business concerns and the concerns about revenue have to be balanced against the health and safety of the people who provide that revenue. Is a red state, which means that almost no matter what happens, the citizens of Alabama are going to vote for the Republican Party. And so these people who are in office know that they really can't mess up their party and so they, instead of the people, they can pivot toward the business interests that help their fundraising, that lobby them, because the people of Alabama really don't have any power if there's really one choice, right? Which is the Republican Party. The Republican Party doesn't have to answer to the people of Alabama because there is no alternative. As much as I would like to acknowledge the Democratic Party in Alabama, in reality, we know that, to be honest, let's be honest, white people in Alabama aren't going to vote for a Democrat, right?
Right.
And so they don't have to answer to the people, right? The people in power don't have to answer to you. Now, there's another thing that people rarely talk about, right? So this idea of austerity and low taxes and the way the South doesn't tax the wealthy. That's what we're feeling now too, right? Because Governor Kay Ivey and the Alabama legislature wouldn't be rushing to open up the country, same thing with Georgia, if we had a progressive tax base that would have stored up this money from these wealthy corporations that would allow us to exist while businesses were closed, right? That's why, I can't understand why you cater to the wealthy if you don't use it to the advantage of the people who live in the area. Why be a part of the wealthiest country in the world if you're not using the money for the people? But we don't use it for the people. We're part of the wealthiest country in the world, and then we give that money back to the wealthiest people in the country, which again is a backwards idea, and it disregards the vast majority of the people in this country.
Well, and we'll be seeing that a year from now, 2 years from now, when we start having to make budget cuts because we've missed out on so much sales tax in the last few months. To close, what's your sort of anticipation of what the state will look like in a month and in a few months?
That's hard to say, right? So I honestly believe that these open up orders, right? We haven't seen one of the biggest prerequisites of what the federal government suggests we do before we open up is to see the infection rate and the death rates decline, right? It's not declining in Alabama yet, right? So what we're going to do is send people out there while the infection is at its peak to infect them again. So I expect that we will see a new rash of infections, which will necessitate another stay-at-home order or some kind of preventative measure, which will make this even worse on the economy, right? Because we could have just waited another month or two and watched it go down, and then made an assessment from there. But instead, we're so eager to rush out not because of the people, right? Because of the business interests. And we're going to create a double recession. So I think that Alabama is going to to see another recession, or the other alternative is like we open it back up and people still don't go out,
Right.
which means those businesses are going to have be open and running their light bills and their water bills and paying employees and getting no revenue. So they might lose more by opening up the country. So, either one of those two things is not a good resolution to this, when all we had to do was to wait and not kowtow to the business interest and treat the people of Alabama's health and safety, put their interest first before we put the interest of like these big money donors and these people who are advising Kate Ivey to go ahead and do what you want so the businesses won't collapse.
Well, Michael, I think we'll leave it there. Everybody can find you on Twitter at Michael Harriot. And thank you so much for your time.
Thank you for having me.